So, Naren, what kind of characteristics do you think a person has that if they're in our, our referral, if they're one of our ambassadors, tell me
Right.
some of the personal characteristics that that person has.
They are outgoing. They are the ones everyone calls when there's a need. I used to have a friend who's like the electronics, technology, electronics person. So anytime, I mean, of course, in those days we had a camera and we had all kinds of technical stuff, right?
Sure.
So I would call him and say, hey, I'm looking to buy a new camera. Like
You
I've
know
had
who
my
to
old,
tap into.
yeah, who do I, and then he's so helpful, and he will go out of the way to connect me. Oh, you should call that company, or you should go check it out. They have a sale going. So he was like the connector. But
Right.
usually those people, like that archetype, that person who's just loves people and helping people and loves talking, is very few. It's like one in like 20, or one in like.
Well, let me share with you exactly what that is. So the characteristics that someone that would refer, they're typically outgoing,
Yeah,
social,
yeah,
they're gregarious. They might not use this term themselves, but they're an influencer.
yes,
They influence others. They're someone that has earned the respect of their peers. By the way, on the D, I, S, and C personality styles, which one of those four are our ambassadors? D, I, S, or C?
I
Which
think the eyes.
exactly the eyes? They're always the eyes, the
Right.
influencers. Now let's talk data here. Let's talk. Remember, Naren, data never lies.
Yes, it doesn't.
People do, but data never lies.
Yes.
So statistically, 25% of the people in the world are high eyes. One out of
Mhm.
four. However, within that group, roughly half of those are sort of eyes turbocharged.
Mm,
They're the eyes that are social, gregarious, outgoing influencers. So statistically, it's about 12% of our population.
right.
So you could have 1,000 patients that love you in your practice. I'm using round numbers to make a point here.
Right.
And you could have 1,000 patients that literally love you and love your office. But statistically, only about 120 of those are ever going to make a referral to your practice. And it's nothing to reflect on you this poorly,
Right.
it's them. If you have an engineer, that's the high C, very analytical, very detailed, maybe maybe works the graveyard shift at the engineering firm. Do you think
Right.
you're going to get many referrals from that fellow?
Probably like 0.0000.
Zero. Now that patient may be just happy as can be
Yes.
of being a patient in your practice. So statistically, it's about 12%. But one of the reasons that I wanted to do this topic in this podcast, Naren, you know that recently we did with our clients, we did book club. Uh,
Yes.
and we did the book written by Dr. L.D. Pankey, Philosophy of the Practice of Dentistry. And I want to read a couple of passages here from that book that talk about this concept of ambassadors. Now, when Dr. Pankey wrote this book, he used the term missionaries. And I'm going to substitute the term missionaries with ambassador. I'm using them interchangeably here. I'll use his words as I read these passages because that's what he wrote. But he said, showing appreciation for your patients will go a long way in having them develop the missionary response of referring new patients to your office. One recommendation is to say something that Dr. Worth, Harold Worth was a very prominent dentist in Dr. Pankey's generation. He was one of the founders of the Pankey Institute. So he said one recommendation is to say something like Dr. Worth, Harold Worth used to say to his patients. And here's a quote from Dr. Worth. Imagine this, Naren, I'm saying it to you as if I was the dentist. Naren, I want you to know how much I appreciate what you have done to make my kind of dentistry possible. I realize the effort it took on your part to understand what we're doing, to keep all of your appointments, and do what you needed to be doing as a good patient. Without the wonderful cooperation you gave us, this kind of end result would not have been possible. Naren, thank you. Now we go a step further and simply say, Naren, if you know someone that could benefit from the way we approach dentistry and the way we take care of our patients, please let them know we'd welcome them in our practice. We'll always make room for friends of Naren. Now, notice what I did. There was I blended a couple of concepts there. But first of all, I started by complimenting you. as a patient.
Right.
You can't do comprehensive dentistry without a participating patient, right?
You cannot.
I got to have the patient all in, right?
Yes.
And they have
Yes.
to be all in many ways. Financially, they have to be all in terms of the time commitment that it might take to do comprehensive dentistry. And today that could be something like, the patient has a floppy lower denture, and they're frustrated with the failing lower denture, and they want a better solution. That's one just an example of one clinical way we can help people today.